the other thing would be, okay, let's say that you have seen the application and it looks pretty good. Say, this person has an recent experience in Korea per se, good resume and everything. You decided to take this person. Do you interview them yourself?
If they're an external candidate and they apply for my job, yes, I would do an interview. And I would also need references from a current employer.
Okay, perfect. The reference has to be in English. The interview has to be in English, obviously.
Yes.
Of course. Any good tips for Korean nurses?
That's a great question. I think if I look at what I would interview a nurse, I'd want, the first thing would be, tell me about yourself, why you applied for the job, and what makes you a good candidate. That's always a really top piece, and that's your opportunity to sell me. The other things are probably going to be in terms of interview questions. When I interview an external nurse, I ask usually experiencing questions. So it might be, tell me about a time that you had a patient that wasn't doing very well. What were your actions and what was some of your follow-up? Then I might ask a question about conflict. Tell me about a time you dealt with conflict, either with a family, a patient, a coworker. I'd ask you a little bit about, tell me about some of the skills and experiences, and tell me about the patient populations you might have looked after. In critical care, I often do ask questions about, did you care for mechanically ventilated patients? And can you tell me about some of the modes you used? Tell me a little bit about some of the drugs that you're familiar with and how you use them on patients. I might ask about a time you had to deal with an emergent or urgent situation clinically. What was it? What did you do? And would you do anything different?
Right.
So it's really trying to get a sense when you interview, what do you like as a nurse and what was the experience? So I'm going to tease out a little bit more than you might have put in your resume. And you do, because it's easy on a resume to put some bullets. It's you can think about it. But as a nurse, you're having to deal with in the moment.
Right.
And the interview is just an opportunity for me to ask, those kinds of questions. Tell me more scenarios and looking to see what your story is. What did you learn? What kind of assessments? Were you using a nursing assessment?
Right.
I made an assessment. I developed a plan.
Right.
I implemented my plan, and then I evaluated.
Right.
So the nursing process.
Right.
And then another question might be, if you got this job, tell me a little bit what you think your biggest challenges are. And again, it's trying to tease out a little critical thinking, a little bit of assessment skill in an interview.
That's great, because now I'm working here in Canada for 8 years now. The key thing that we consider would be a teamwork.
Yes.
Now, when you're interviewing person, not only you're asking for their experience, what they have experienced when they were working, but also as a person, how would you cope with all these problems?
Yeah.
You're looking into more like a holistic kind of picture in that applicant. Is that right?
Yes.
Yeah.
And you're looking to see too, I think a lot of times what I look for, key things I look for in an answer are maybe they didn't know the answer, but did they communicate and did they use their team? So, I admitted a patient who came in on a new ventilator mode. And so I made sure I worked with the respiratory therapist. I asked him to do some teaching. I checked with my charge nurse. Or in the conflict question, if I had a conflict with a patient or a family member, did I then communicate that to my CRN, and did I communicate to my manager? Or are you just telling me answers that's just about yourself and there's no work on advocating, communicating,
Co-workers.
Teamwork, escalation, those types of things?
I see. We're almost done with this interview here.
Okay.
So my next question would be, what would be the key thing that you would not pick that applicant?
I think you mentioned a couple already. I think that very long gap in employment is typically a really warning sign. There's such a long gap. I'm not sure that the time I need to invest, are you better off to go to school? I can't reteach a nursing school with 10 years, right?
Yeah.
We have limited ability to do that. I think that's always a warning to me. The other thing that's always kind of concerning to me, and you do have to be honest in your resume, but people who are in places for 3 months, 6 months, 2 months, and I look at that resume, to me that tells me, why are you jumping around so much? Is it because you just get bored and you move on? Is it that you've had conflict? You've not managed to settle in well?
Right.
But those are usually warning signs when you see that people move every sort of so many months. And again, it really does come down to saying that you need that nursing license, right? For me to consider somebody, even if we have a great conversation over the phone and I think, wow, this could be a really great nurse, I can't help you through the Canadian licensing and Manitoba licensing.
You can't, no.
I just can't as a manager. I have no control over what happens out of there.
Of course, yeah.
But those would be a couple of things I think that would tell me. And I think your skill set too. So as an ICU, I would never, if you worked in a clinic, thank you so much for applying, but you're just not going to be a qualified. You have to meet my skill set. So whatever the job description is, you have to be able to meet those minimum expectations.
Right. Sometimes we think that, we hear stories about, there's shortage in nurses in Canada, this province, that province. Maybe it'd be easier for us to apply and get a job. But then the reality is, they actually do look at your ability. They look at your experience and any other things.
Yeah. And you can have a really high vacancy, but at the end of the day, we have to make sure that we have the right people looking after our patients to provide quality, safe care for patients. And you can be in a nursing shortage, but that doesn't mean we'll just take anyone off the street, right? That says that there's lots of nurses out there, but they're not always suited to the environment.
Right. Even though you have an ICU experience in Korea, you don't want them to apply to ICU in Canada because you may have a different training and everything.
Very different training. Very different training. And I'll just, for that part, if you're an ICU nurse in another country, we almost wouldn't take you into our ICU directly. We'd almost encourage you to go to wards first to know what Canadian healthcare and how to manage, and then come to the ICU.
You're right. Perfect. That's very important, I think.
Yeah.
So last question. Is there a last thing that you would advise to future Canadian nurses in Korea?
I think, I think try to come to Canada. We're very fortunate in the world to have a public healthcare system, and although we're stretched thin, I think we have amazing opportunities for nurses here, and nursing in whatever facet you might want. So I think there are opportunities to either work in elderly, in mental health, in community versus acute care. There's lots of opportunities. You just have to figure out what your skill set and what you want to do. Once you're here, nursing is the sky's the limit for in terms of career opportunities.
Right.
Everything from, like I say, working for public health to small private clinics. So I think there's a lot of nursing opportunities here, and I think they're only limited by your imagination.
So there's many things that would be in your way. However, keep on trying.
Keep on trying.
There will be opportunities.
And I think it's worth it. There's always challenges and roadblocks that are put up.
Of course.
But don't give up. Just keep pursuing. And don't forget to really reach out to the college and ask for help. Don't just apply and do nothing or unsure of the process. Reach out, because I think the Canadian provinces, they're looking, right? They're looking for people to come and how we can improve the process. Is it perfect right now? No. We know that.
You're right.
Will it get better? Let's hope so.
Right.
But if you don't reach out to people,
you won't get anything.
You won't get anything.
Right.
So reach out. Even if you're applying for jobs and you reach out to a manager and say, I'm trying to get to Canada. What can I do? you know, and they hopefully will navigate you to their HR department who may navigate you somewhere else. So reach out, do the research, but reach out as well.
That's a great tip. And then I think the encouragement from you would be I think it's a very good motivation to the nurses in Korea.
Yeah.
Thank you very much. Thank you very much for your time, Chris. I really appreciate it. Thank you.
Oh, thanks for the opportunity.
Thank you.
And good luck. I hope we get some visitors to Canada that'll stay.
Alrighty, thank you very much.